Today, because of the way healthcare segment has expanded horizontally, not just vertically, horizontally, there's so many more other core domains that co-function along with the clinician within the healthcare setup. Today, a hospital or a healthcare setup is not just a doctor and a patient. It's much more than that. There's so many more departments involved. There's so many more functionalities that have come in. There's so many more professionals that work together in a healthcare sector today to keep that hospital or healthcare setup running. So when I say breaking stereotypes in healthcare, I wanted to talk about the highly in-demand non-clinical career avenues. Now, I didn't want to start with this slide because the moment I say non-clinical, there is a glitch, there is a step back for everybody. But like I said, this discussion is for all those post-MBBS students, people who are trying to build their careers up, or somebody who wants to have a shift in the career from being a clinician for some time. Non-clinical arenas have greatest prospects today for clinicians within and outside the healthcare sector. The reason I say that, because as a clinician, you have that basic understanding about medicine and clinical skills. And anything added to that will only add value to the organization you're being part of or something that you want to run on your own. So let me discuss a little bit about what are the exciting non-clinical career avenues that a post-MBBS grad can think of. Have you ever thought of an MBA post-MBBS? Well, probably not. Some of us might have. I've thought about it after quite a few years in clinical practice, but there's nothing wrong about thinking about getting into the administration or management side right away. There's nothing wrong. Because today, managerial skills, leadership skills, and administrative skills are equally important for any and every clinician. You could be running your own healthcare setup, or you could be part of a multi-specialty hospital, or you could be part of a polyclinic, or wherever you are. Management, leadership, and administration go hand in hand today along with the clinical skills. Understanding of certain basic functions becomes essential for all of us, and these functions and skill sets are not taught to us in medical schools. For example, today a lot of us probably would want to come out after medical school and get into a specialty and probably then run our own thing, do our own thing, probably set up a hospital or a clinic, whatever, a small unit. But where to start with, how to plan, what all to include, and how to execute it requires effective strategic thinking and executive knowledge. And that is something that we need to be trained on. So probably an MBA in entrepreneurial skills, or a general management and business administration MBA, or an MBA in healthcare management and hospital administration. Like I said, today the hospital functions with the harmony of so many more departments, and to understand the functionality of each, probably an MBA in healthcare and hospital administration, that allows you to function more effectively in your own role. And tomorrow, if you want to take a leap of faith and take a step forward and probably build something on your own or run something on your own. I mean, today we see a lot of doctors, clinicians running the hospitals as CEOs and COOs. A lot of clinics and healthcare startups are being driven by clinicians who are core clinicians. So that definitely requires certain skills in areas where we have not been taught or we've not been trained. There's nothing wrong in polishing those skills. So think about an MBA in hospital and healthcare administration. There's tremendous career prospect. If you have a hospital with 10 specialties, you need at least 4 people to run that hospital effectively. So out of those 4, one needs to be a senior administrator. If you have a hospital of any capacity, 100, 200 beds, 300 beds, the more the number, the more differentiated the layers are, and you need managers and leaders there. And all of us end up working as part of a team, or we run a team, so we need to learn these administrative skills. So think about MBA in hospital and healthcare administration. There's great prospect to that. Like I said, if you're a doctor with an MBA, it adds that greater edge because you know the system pretty well. That's one industry I wanted to talk about. And a little within this zone, but I wanted to separately discuss. Today, quality accreditation for hospitals and healthcare is at the top of its reach and need. Every hospital is going in for an accreditation. Now, quality department and being accredited are two things which go in together. Every hospital today has a quality department. There are quality parameters and goals set for individual departments and also the entire hospital as its own. And accreditation is nothing but an external auditing body like NABH, National Accreditation Board for Hospitals, or Joint Commission International, JCI. External bodies, when they come and audit a hospital and put a seal on it, saying that they abide by these set standards of quality and patient safety, that adds that extra value and credibility and edge to that healthcare setup, which will bring in more business, revenue, patients, and also great testimonials from their customers. The customer recall is so much more when they have that quality accreditation. So every hospital and clinic is looking at it. Labs are accredited, nursing units are accredited. There is a different quality department that is being set up in each hospital. So have you ever thought of being probably part of being a quality department, or becoming an assessor, or being part of an accreditation body in the hospital? One can also, if you are somebody with set number of years of experience in healthcare, you can also apply to the NABH board saying that you want to be an assessor, so that you can go around auditing hospitals and become that assessor. Or you can be part of the board in a single hospital and drive the quality edge of that hospital. You could also be a senior administrator in the hospital, or a superintendent, or a resident doctor for that matter. But you can get into these specific roles. Like I said, today there is a quality department in every hospital. Every hospital is looking at maintaining their accreditation standards. So there is a great scope for it as well. So I spoke about hospital administration, I spoke about NABH or any accreditation, and quality, becoming a quality professional as another. So this is a semi-clinical career. It's still clinical career, but you can become a, you can get into the administrative or management side of it. Or, like I said, becoming a healthcare entrepreneur today. A lot of the startups, healthcare startups, there's so much boom today in healthcare startup market today in India and outside. And a lot of them are young clinicians who are coming up. So if you're somebody who's passionate about business, if you understand the terminology, if you understand the market that you want to get into, and why not? If you're passionate about it, being a clinician shouldn't stop you from picking up an entrepreneurial career. So there are a lot of institutions which offer a lot of courses for doctors. So for example, we've got wonderful eCornell courses. eCornell is the e-learning wing of the Cornell University, one of the Ivy League universities in the United States. So we've got a bunch of eCornell courses that sit with us, which talk, a lot of them talk about the business excellence for healthcare professionals and women in leadership and all that about leadership and management. So why not? If you're somebody who's interested in entrepreneurship, probably learning the tricks of the trade and getting into it and then tagging along might help, rather than just, going ahead with it. Or if you're somebody who wants to get a comprehensive understanding of things like finance and accounting and human resource and all that, strategic thinking and execution, probably why not? So an MBA or an entrepreneurial program can also take you through a different direction to another level. So think about that. The other two industries that I just want to mention, which have been there but probably will be incomplete if I don't discuss them. Medical insurance today, health insurance today is part of healthcare so much more than ever. So healthcare insurance and medical tourism are two things that if you can put together and talk about and look at it, again, have a greater scope. And a lot of the healthcare setups are looking at heavily investing in these industries, and also they're definitely there, and every hospital is looking at expanding their base through this. And there are a lot of if we're talking about the market in India, there are a lot of foreign nationals who've come down for treatments here, management here, and a seasoned professional who can drive that for the hospital can add great value. So medical insurance and tourism. Lastly, before I move on to another slide, have you ever thought about biomedical engineering? We talk so much about AI today in medicine, isn't it? Artificial intelligence is everywhere on the medical journals, in every news that covers up, in every media coverage, it's there. AI has become so much. Robotics and artificial intelligence has become so much talked about in the healthcare. There is a place there for clinicians as well. Of course, as part of the departments and the roles they are playing, but I'm also talking about it behind the AI also. If you want to be a biomedical engineer, or if you're somebody who's interested in understanding how technology can help you in driving that clinical outcome, and how to build new clinical solutions using technology,